Since the beginning of the coronavirus, a number of states have just coincidentally found this to be the perfect time to try to restrict individuals' access to being able to get abortion and other related services in their states. One of the biggest back and forths over the past few weeks has been in Texas, where you have almost on a day-to-day basis been able to, then not been able to, then been able to, then not been able to get access to an abortion at the incredibly limited number of clinics that are allowed to operate there even in normal times. But in addition to Texas, we have 12 other states: Arkansas, Alaska, Mississippi, Tennessee, Utah, Oklahoma, Ohio, Indiana, Kentucky, Alabama, Louisiana, and West Virginia have also attempted to curtail abortion access in some way under coronavirus-related bans. And while at times the Texas moves have been overridden by courts, that is not always the case in other parts of the country. The U.S. Court of Appeals for the Eighth Circuit said that Arkansas can suspend abortions during the pandemic. In the opinion, a federal judge writes that while medications, abortions using pills may continue, surgical abortions that are not immediately medically necessary are prohibited. So Aaron, I imagine not probably super surprised that right-wingers are taking this opportunity to accomplish these goals.
I mean, it's another example of people who are craven, using a crisis as an excuse for them to push through an agenda that doesn't really have anything to do with the crisis itself. Like, for women who are pregnant and don't want to be, or can't for whatever reason have a child, time is of the essence. And it's like, I feel like that fact is something that literally everybody knows. Pregnancy is progressive, and it's not something that you can just hit pause on because there's a pandemic going on. The fact that I just find it all so inhumane. I don't understand the purpose of doing this. Like, because,
well, okay, I think part of the purpose is they don't want women to ever have an abortion.
Sure. Okay. So let's say that they don't want women to have an abortion, but if you're a woman who's pregnant and doesn't want to be pregnant, you're going to figure out a way to not be pregnant in almost every case. And if you make a woman wait, the longer you wait in a pregnancy, the more complicated, costly, time-consuming, and the more downtime you have. So essentially what they're doing is creating a backlog of more complicated procedures that are going to happen either in their own states once a judge overturns what these dumb laws are trying to accomplish, or in other states. So what is happening is that it is ultimately taking more resources from medicine than it would have been if they just let women take care of their reproductive health when they wanted to. That's the thing that drives me nuts. I'm glad that, to Arkansas's credit, it's the only time I'm ever starting a sentence that way, to Arkansas's credit, that they're allowing medication abortions to continue. There are some states that are trying to limit that, which is completely nonsensical, because a medication abortion is like you take one pill at the doctor's office and you take another one when you go home that night. And there's no reason to prevent people from doing that.
Yeah. Yeah, I think one of the big differences here, because as you point out, if you want to get it, you're going to be able to get it. It might be more expensive, more inconvenient, more dangerous, perhaps. But it's certainly possible. I think one of the differences is that, like, we can identify policy-based differences along the ideological spectrum, but I think that the willingness or eagerness to just inflict suffering as a punishment is not necessarily evenly distributed across the ideological spectrum.
Right.
Trump famously said during the 2016 election, he was asked by, I think it was Chris Matthews, oddly enough, but should there be some sort of punishment for women who underwent an abortion? And he said, yeah, they should be punished.
I remember watching that. I'm thinking, like, there should be some form of punishment. Like, being pregnant when you don't want to be pregnant is punishment enough. Like, that is, it's not fun. Nobody likes having an abortion. It's not fun for anybody to have a medical procedure. I think that the thing is, like, first of all, to use this oft-used quote, the cruelty is the point. I also find it kind of ironic that, a lot of the people who are trying to prevent women from having abortions are people who identify as Christians, and their New Testament God would be forgiving, and they're acting very Old Testament God-like by trying to punish people and inflict suffering on people that they believe have somehow not behaved in the way they want them to behave.
Exactly. It's a very hierarchical system, and if you are in one of the lower rungs of that hierarchy, you're kind of asking for it by your very nature, but especially if you transgress against the dictates of those at the top. Like you said, the cruelty is the point. That's what they want, and many of their voters want to see it. They want to see, like for instance, we know statistically, drug testing people who get some sort of public benefits or something like that is a waste of money. Very few people do. It's a waste of money, but Republican voters still very much support that because they like the inconvenience being put on the people who get the money. They like the humiliation being put on. These are people that they look down on. And while they might not be doing well economically, it makes them feel good to see someone else being hurt. It's unfortunately a very successful strategy in America.
Yeah.
Now, really fast, in response to many of these Republicans saying that these are not necessary procedures, I just want to read a response. The American College of Obstetricians and Gynecologists and the American Board of Obstetrics and Gynecology released a statement on March 18th naming abortion, quote, an essential component of comprehensive health care. They write, quote, it is also a time-sensitive service for which a delay of several weeks, or in some cases days, may increase the risks or potentially make it completely inaccessible. For example, in Ohio, where most abortions are banned after 20 weeks, a delay could make illegal abortion nearly impossible. And the acting president for Planned Parenthood said that the impact of these changes can't be understated. There's been over a 700% increase in patients leaving Texas to seek abortion in other states over the last weeks. And the thing is, this is just the most recent slap in the face for women trying to exercise their constitutional rights in Texas. They already had to drive on average in that state 260 miles for at least 4 hours to reach a clinic on average, because in this massive state, there were 23.
Yeah, it's not doing great. I think a lot of people think that just because Roe v. Wade is still technically intact, that women have access to abortion, and that's not the case. And right now, especially during the pandemic, when we're seeing people who are already pushed to the margins, having their options even more limited, I think people who live on maybe some coastal bubbles should get a better sense of just how precarious the right to abortion is for most American women.
Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.